Okay, let's talk about something that's frankly terrifying for just about anyone: a seriously ill child. It's a high stakes, high stress situation. But what we're going to do today is pull back the curtain and look at the calm, methodical system that medical professionals use to bring order to that chaos. So let's get right into it.
Wow. I mean, that quote really says it all, doesn't it? A daunting case, even for the most experienced of clinicians. The stakes are just incredibly high. This isn't just scary for parents. Even seasoned doctors and nurses find these situations incredibly challenging. And it's exactly because it's so tough that this structured, reliable playbook was developed.
So here's the bottom line. When things get scary, panic is your worst enemy. A plan, a structured plan, that's your best friend. It's not just about having a checklist, it's about having a system that cuts through the chaos, that lets you think clearly and make those rapid, life-saving decisions when every second counts. All right, so here's our game plan. We'll start with why a sick child is such a unique challenge. Then we'll jump into the real core of this, the ABCDE approach they use in that critical first minute. We'll look at what comes after that initial check and then wrap up with the big takeaways you should really remember.
So let's start with the big challenge. Why is early recognition so critical? Well, here's the harsh reality. The data shows that once a child actually goes into cardiac arrest, the outcome is, well, it's often poor. So the entire goal, the whole philosophy, is to never let it get that far. It's all about seeing the trouble coming, spotting those early signs of breathing or circulation problems, and jumping in before things spiral out of control. Okay, so how do they do that? This brings us to the absolute core of the professional's toolkit. It's called the ABCDE approach. And you've got to understand, this isn't some deep, long diagnostic process. No way. It's a lightning-fast, systematic check designed to do one thing and one thing only: find and fix the problems that can kill a child in the next few minutes.
And when I say fast, I really mean it. We're talking less than 1 minute. Think about that for a second. In under 60 seconds, a professional can run through this entire initial check. They can get a complete picture of all the immediate, life-threatening problems. It's just unbelievably efficient.
So here it is, the framework that guides everything. A, B, C, D, E. And the order here is absolutely critical. It's not random, it's a priority list. I mean, think about it. A clear airway doesn't do you any good if you're not breathing, right? And breathing is pointless if your blood isn't circulating that oxygen around your body. It all builds on itself. So let's start at the very beginning with A.
A is for airway. And this is always, always step one. You have to ask, is the airway open and clear? Because honestly, nothing else matters if air can't get in and out. It is the number one priority, period.
So, how do they check it so fast? It's really simple and sensory. They look, listen, and feel. Are they looking for chest movement? Yep. Are they listening for breath sounds? Absolutely. Are they trying to feel for expired air on their cheek? You bet. And if there's a problem, simple things like a head tilt or a chin lift can often fix it right away. But there's one key warning sign they're listening for: a sound called stridor. It's this harsh, high-pitched sound, and it's a huge red flag for a serious blockage. All right, so the airway's clear. Great. Now we move on to B, for breathing. And again, this isn't just a simple, are they breathing, yes or no check. It's way more nuanced. The real question is, how well are they breathing? And I love this part because it shows you how deep this rapid check really is. Professionals break breathing down into what they call the 3 E's: effort, efficacy, and effect. So effort is about how hard the child is working. Are their nostrils flaring? Are they using all these extra muscles in their neck and chest? That's a sign of high effort. Then there's efficacy. Is all that work actually doing anything? Is air moving well? Is their chest expanding like it should? And finally, effect. What impact is all this having on the rest of the body? Is their heart rate sky high? Are they getting sleepy or confused? You see? Together, those 3 things paint a complete picture. And here's something that's super important to understand about breathing. Normal completely depends on how old the child is. Look at this. For a baby under 1, breathing 35, even 40 times a minute can be totally fine. But if you see a 10-year-old breathing that fast, that's a huge warning sign. So you can see why knowing these ranges is just crucial. It's what allows a professional to know if what they're seeing is normal or a sign of big trouble. Okay, so we've got airway and breathing. The assessment immediately moves on to C, for circulation. The big question here is Is the blood actually flowing around the body and delivering that vital oxygen to the organs?
Now, this right here is probably one of the most critical things to understand about sick kids. Children are amazing compensators. Their bodies will work overtime to keep their blood pressure normal, even when they are getting really, really sick. And that's a trap, because if you wait until the blood pressure drops, what we call hypotension, you've waited too long. It's a very late and very bad sign. That's why professionals are trained to look for other, much earlier clues. So what are these earlier clues? Well, they're looking for a really fast heart rate. They're feeling for pulses in the hands and feet to see if they're weak or thready. They'll do a capillary refill test, where you press on a fingernail or skin and see how fast the pink color comes back. It should be super fast. They're also just looking at the skin. Is it pale? Is it cold to the touch? Is it getting kind of blotchy or mottled? All of these are the body's early warning signals that the circulation is in trouble, long before the blood pressure gives out. Okay, after C comes D for disability. Now, this isn't about long-term disability. In this context, it's a rapid-fire check of their neurological status. Basically, what's their level of consciousness? How is this whole situation affecting their brain?
And to do this quickly, they use a really simple tool called the AVPU scale. It's super straightforward. A is for alert, V is for response to voice, P is for response only to pain, and U is for unresponsive. It's a brilliant way to quickly summarize a child's mental state. You can see how it maps to the more complex GCS score, but in an emergency, AVPU gives you the information you need in seconds. And let me tell you, if a child is down at P or U, that is a 5-alarm fire.
And that brings us to the last letter in our initial check, E for exposure. This is the final piece of that quick, under-a-minute survey. So what does exposure mean? It means they need to briefly and safely have a look at the child's whole body, from head to toe. Why? Because the key clue to what's going on might be hiding under their clothes. It's like being a detective. They're looking for anything unusual, a weird rash, maybe a purpuric one that can scream sepsis, or bruises that could point to an injury. Of course, this is all done incredibly carefully, making sure to keep the child warm and preserve their dignity as much as possible. Okay, so that's the first minute. The ABCD check is done, and any immediate threats are being handled. Now the focus shifts. If that first assessment was all about answering the question, what is going wrong right now? This next phase, the secondary assessment, is about figuring out why it's going wrong. This is where they can dig a little deeper, ask more questions, and do a more thorough exam. And a perfect example of the kind of thing they're hunting for is sepsis. Sepsis is this life-threatening, full-body reaction to an infection. The problem is, it can look like a lot of other, less serious things at first. It's a real wolf in sheep's clothing. So for any kid who is just inexplicably, seriously unwell, sepsis is always on the list of suspects. That secondary assessment is designed to sniff out exactly these kinds of hidden killers.
All right, we've gone through the whole process from that first minute onwards. So let's boil it all down. What are the key principles you should really take away from the professional's playbook? What are the big ideas that guide everything?
Okay, here are the core takeaways. Number 1, a structured plan like ABCDE is everything. It turns chaos into calm, panic into a process. Number 2, the early subtle signs are what really matter. Things like breathing effort are way more important than a late dramatic sign like low blood pressure. You have to catch it early. Which leads to number 3, the name of the game is prevention. It's all about recognizing the problem before it becomes a full-blown crisis. And finally, this is not a solo mission. It's a team sport. The pros know to call for help and to call for it early.
So there you have it. That's the framework, the systematic approach that professionals use to handle one of the scariest situations imaginable. It's all built on a logical foundation of priorities, of looking for the earliest clues, and of acting fast. And that really leaves just one final question for you to think about. Now that you know the logic they use, do you feel like you could be just a little bit better at recognizing those very first signs that something might be seriously wrong?